right, I'm going to talk you through how to do a home testosterone injection. First thing you'll want to do is be sure to have all your supplies ready. So we'll need your vial of testosterone, some alcohol swabs, and of course your syringe with needle. Sometimes the syringe and needle are already attached, as in this case. Sometimes they're separate and you'll attach them. And I'll show you how to do that in a minute. You'll always want to be sure to wash your hands in advance, and if you're injecting on another person, I always recommend wearing gloves. Lastly, I would have some type of sharps container nearby, so after you complete your injection, you can drop the used needle directly into your sharps container. You can purchase a small red sharps container on Amazon very easily, or alternatively, you could use a empty shampoo bottle, an empty laundry detergent jug. Just of course make sure to label it clearly and keep it, out of reach from children. When your sharps container is full, most cities have a specific place where you can go for sharps disposal and drop off. All right, so we're ready to draw up the medication. Here's our syringe with needle. In this case, we have a 23 gauge needle. Sometimes it's a 25 gauge needle. For simplicity, we often use the same needle to draw up as we use to inject. However, if you're comfortable with it, you can use a larger, for example, 18 gauge needle to draw up the medication. It makes it a little easier to draw it up, and then you can always easily twist the needle off, put the smaller needle on for injection. So the needles twist on and off very easily if you choose to change needle size. For this demonstration, I'm just going to use the same needle for drawing up and injecting, excuse me. All right, so first thing we're going to do is make sure we clean the top of the vial really well. We don't want to introduce any bacteria into the vial, as this can contaminate all of the medication. So be sure to clean the top really well first, like such. I'm just really giving the top a good clean with the alcohol wipe. These vials are generally designed to be discarded 28 days after puncture. So 28 days after you initially puncture the top, they should be discarded. When it's time to inject, the first thing I always do is add a little bit of air to the syringe. And it doesn't have to be exact. I usually draw up the approximate amount of air that matches the amount of medication I plan to draw up. So in this case, maybe about a half a syringe worth of air. I'm going to take the cap off and go straight down into the clean vial. And you're going to inject that air in, and then simply flip it upside down and ensure that the tip of your needle is in the liquid or in the medication. Testosterone is thicker than water, so you'll notice, I'm going to come closer, when you first pull back, you may not see a lot of liquid go into the syringe. I don't know if you can appreciate that. It is starting to fill up, but you can see it going down that side rather slowly. That's normal. Just be patient, and that will fill up. Everyone's dose could be slightly different, so be sure to check your prescription label. This particular patient's dose is 30 units or 0.3 milliliters. So I'm going to bring that horizontal black part of the plunger there right to that 0.3. And then I simply remove the vial, and this is filled and ready for injection. So the gluteus is one of the most common places we do this injection. And let's just talk about some ways you can find the proper location. One way is to sort of find the midline on the patient, and at the top of the crack there, just go up about an inch and then go over to the outer side of that hip. This would be an appropriate location for your injection. An alternative way to find this spot would be to just look at one half of the gluteus. If you were to divide this half of the gluteus into 4 quadrants, imagine dividing that into 4 quadrants, you want to be in this upper outer quadrant. And if you're in there, you're probably in a safe spot. One additional way that we sometimes use is to put your hands on the patient's hips and then press your palms down. Where the bottom of your palm falls or touches, right where I'm pointing, this also can indicate an appropriate good spot for the injection. Okay, so let's do that injection. We can again find that location a few different ways. We can go right about here. We can also find the top of the crack, go about an inch above and over, and we're always in that same general area. You just need a little corner of the rear showing, Sometimes I make a little nail mark so we know exactly where we're gonna go. Of course, we're gonna clean the skin real well with another alcohol swab. So we clean really well. All right, and for these injections, I never pinch the skin like you would for a subcutaneous injection. For these, I always spread the skin or make it rather taut. So when it's time to inject, you'll remove your cap, hold your needle almost like a dart. You're gonna spread and make that skin taut. I always give the patient a warning, 1, 2, 3, and then you're just going to press that medication in. And that's it. You can see we have no bleeding occurring here. Sometimes you'll get a drop of blood that you can dab with a piece of gauze. If your syringe and needle have a safety cap, you simply press that up till it clicks and it covers that needle. And that's it.